Welcome to Sutter Health and CPMC's Breast Health Center, where we provide you with the full spectrum of breast health care, from initial exam to diagnosis and to breast health treatment. In this short program, we look at the reasons for having your biopsy, and specifically what you can expect when you schedule your stereotactic breast biopsy with us.
So a stereotactic core biopsy is guided by mammographic guidance because it's used for findings that can only be seen on the mammogram, not seen by ultrasound or not palpable to the patient or the doctor, only seen on the mammogram.
The technician explained very well, the procedure very well to me, so I was comfortable by the time I was sitting on the chair.
Told me that it'd be a very easy procedure, not to be alarmed, not to be afraid, that there should be very little discomfort. They'd make it as comfortable for me as possible. If I needed anything, to be sure to let them know.
There was no actual preparation for the biopsy. As a matter of fact, that you can have a regular activity and just show up.
While the actual biopsy procedure only takes about 15 to 20 minutes, be prepared to be at the Breast Health Center for an hour and a half to 2 hours. Before the biopsy, make sure you tell us if you are taking any kind of blood thinning medications and report any other medications or supplements you are currently taking. It is important that you do not take aspirin, vitamin E, ibuprofen, naproxen, and blood thinning medications for at least 4 days before the procedure. Be sure to arrive 15 minutes early at the California campus. Register in the lobby of 3698 California Street, and then take the elevator to the second floor of the Breast Health Center. There you will check in at the front desk. You may eat and drink normally before the procedure, and you can come alone or bring family or friends. They can wait for you in the waiting room during the procedure.
Overall, it was a very comforting, reassuring procedure and prep before the procedure. It relieved a lot of my concern and worry.
The day I went to get a biopsy, I was very scary. I think everybody is, because you still don't know whether you have something or not. But I was ready to find out.
This is what a patient can expect from a stereotactic core biopsy. They would come to the breast center, be brought into the stereotactic room. The procedure would be explained. They would sign a consent and then put into the stereotactic machine, maybe sitting up, maybe lying down. We would then use mammograms, very low dose, to find the area of concern. Once we find it, the patient has to hold very, very still, because usually these are very small areas. We can numb up the skin, put the needle in, and then confirm that the needle is at the location of interest.
After I was placed in the table, they then proceeded to tell me that they would need to numb the area of the breast, that it would be a pinch, and that I could hear I might hear some, like a popping or a clicking sound as they numbed the area. And the thought of somebody sticking a needle in my breast was kind of nerve-wracking. I figured it was gonna really hurt, but actually it was like a little pinch. I could barely feel it. And then there was a popping sound, but since they had already prepared me for it, I wasn't too concerned.
I knew I was in good hand, and I also knew what to expect, so there's no internally, I wonder how long it takes, I wonder if they're done, I wonder what they're doing. So only the initial, I think, sting for the local anesthesia. After that, I was like, okay, I don't know what's happening, but I'm in good hand and it'll be over soon.
When we do a stereotactic biopsy, we take little cores of tissue. They look like little pieces of linguine, maybe about 1 inch long. We put them in formalin and we send them to the pathologist across the street. Usually takes about 2 or 3 days before we can get the results to the patient. That's the hard part, waiting to find out exactly what's going on.
After the biopsy, waiting for the results, even though no matter how long it takes, it really feels long because you don't know how it's going to turn out. I think it's natural we all worry.
After the procedure is completed, the technologist will apply antibiotic ointment and a Band-Aid to the site of the biopsy. We will provide you with a small ice pack that can be placed in your bra after the biopsy. The technologist will provide you with instructions to keep the ice pack next to your breast for a total of 3 hours, with intermittently placing the ice pack in the freezer to refreeze. We want you to avoid lifting anything over 10 pounds for at least 24 hours after the biopsy. This gives the incision time to heal a bit. In the days after your procedure, you should expect some moderate residual pain. Likewise, there may be some swelling and bruising. This is a normal result of the biopsy. The results will be available within a week, and you will receive them from a breast health center clinical nurse.
So after a biopsy, we do recommend that you take it easy that day. Though some patients will go to work and do fine, some patients will go home. Often they're tired. It takes a lot of adrenaline to get through the procedure, and once the adrenaline crashes, they may feel tired. So a lot of patients just like to go home and take it easy.
On the day of biopsy, I took it easy as recommended. Perhaps that I just needed the excuse to lie down on the couch, so I did. But starting the following day, I went back to regular sort of a light exercising, walking, and doing everything else I do. I wish I had the excuse to take a day off from work, but I didn't.
Even though it's a scary thing, you need to take care of it, and you need to make sure it's benign, and then within a matter of 5 days, you'll be back moving on with your life, and it'll be behind you, and the worry won't be there.
If you would like to learn more, here are some helpful sources of information. And of course, you can always call the Breast Health Center with your questions.